Hello, and welcome to Health Talk, a show where we dive into common health challenges with local experts to bring you the information that you need to live your best, healthiest life. My name is Dr. Desmar Walks, family physician and local health authority for Austin-Travis County. Violence in our communities affects all of us, impacting not just the individual victims, but also families, neighborhoods, and entire cities. As we face complex challenges in public safety, it's crucial to remember that violence is preventable, not inevitable. By addressing root causes and implementing evidence-based strategies, we can create safer, healthier communities for everyone. Today, we'll discuss what's being done to make our communities safer and how we can play a role in fostering a more peaceful Austin. Our guest today is Michelle Myles. In her role as the manager of the Office of Violence Prevention in Austin, Texas, Michelle seeks to uplift the voices of those most impacted by trauma and invest in targeted interventions to make Austin a place where hope, peace, prosperity, and health are experienced by everyone. Throughout her career as a clinical psychologist, Ms. Myles has worked to increase understanding, leading to the healing of individuals who have experienced trauma, abuse, and violence. Welcome, Michelle.
Thank you for having me, Dr. Waltz.
We start off by asking people what is their why. Why do you do this work?
Why do I do this work? This work is really personal to me. When I was a kid growing up in Detroit, it was very violent. And I had lots of friends and people I've known that have been murdered due to gun violence. And because of that, it really made me want to solve the underlying issues that contribute to violence and harm. As a kid, to see Detroit rapidly descend into chaos due to divestment, systemic racism, jobs leaving, it really seared into my spirit a desire to work to transform communities, and initially when I was a kid, I have a kind of a gift in math and science, and I wanted to go into either medicine or some other vehicle to help community or to help people, and life took some twists and turns for me, and here I am back to what I originally wanted to do as a kid, which is to work to find other solutions and other ways that helps to strengthen communities and individuals so that we can live our best, most peaceful life.
We're very blessed to have you in this community. Let's talk about stress. We know that many people are struggling with high levels of stress. And can you speak a little bit about what's the connection between the levels of stress that we as a community are facing and public safety?
Oh, wow. That's a good question. I think COVID is to me, it's like the most recent collective experience that we had regarding stress. Current COVID was a very new thing. It was very uncertain. People were dying due to the need for lockdown. People were isolated. People didn't have work, or they lost social connection. And due to all these different stressors and the allostatic load of stress, a lot of very elevated behaviors happen and violence increased, right? Even if a good example is on planes, like people would go on the plane and they would really freak out. And, a lot of times people are like, well, why are these people doing it? But if it's happening consistently, along with violence increasing all at the same time, it kind of points to what happens when a community or the nation or the world is experiencing a high degree of stress. Now, if you can translate that into communities who have historically experienced high levels of stress from, like I said before, systemic racism, no jobs, no support, no one cares about them. Those factors are, impacting our natural stress response, right? And so when we're thinking about the stress response, which is basically a survival mechanism. I know you know this, right? And so it's that fight, flight, freeze. And even if you're not experiencing violence, if you're just having stress, it's still activating the same system in the body. And typically when we're not under high levels of stress, our brain's prefrontal cortex, which is the executive functioning of our brain, it's the one that tells us, how to make good judgments, right? But when we're under stress, the amygdala is triggered, which is the more primitive part of the brain. And the amygdala is designed to get the body to respond to a danger, not think about it, not decide what to do, act. So you're making decisions, not really making decisions, you're just acting. And your body is designed to do that. So if you're experiencing high degrees of stress, and your brain is just telling you to act, that is usurping your ability to make the best judgments. And so at the Office of Violence Prevention, we designed a campaign called Address Your Stress so that we can educate the public on how the stress response can impact the decision-making and how it can, if it's not checked or addressed, how it can lead to violence. So I guess, that's basically how stress can lead to violence.
How do you define violence from a public health perspective?
Now, that is a good question. And I kind of borrowed a definition. The public health definition of violence is the intentional use of physical force or power, threatened or actual, against oneself, another person, and that's interesting, oneself and another person, right? Mm-hmm. Or a group or community, which either results in or has a high likelihood of resulting in injury, death, psychological harm, maldevelopment, and deprivation. So sometimes we think of violence only occurring as I'm doing something to harm someone else, but violence is also can be perpetrated onto oneself, and so when we're looking at addressing violence and harm, we want to take a very holistic approach and look at not only, what happens to others, but what we do to ourselves in a way to ensure that you're taking care of everyone.
That's an interesting definition because I've heard one person in a restorative justice conversation describe ignoring somebody as a form of violence. And when you talk about harming oneself and ignoring self, mm-hmm. then becomes a form of violence and harm to self. Mm-hmm. Interesting. What are some of the approaches that are important to your work in violence prevention?
Some of the approaches that are really important is violence cuts across many contexts, right? And where you see one form of violence, you see multiple forms of violence. So it's important to take a very holistic approach. And for the work at the Office of Violence Prevention, it's really important to take this very whole city approach, right? So that we're looking from different modalities, working with community, working with law enforcement, working with the medical system, working with the city, the county, everyone. This is all hands on deck, right? And if it cuts across many contexts, that means it's a very societal issue. And so taking that approach, putting all the brains together to kind of come up with a plan to address violence. So we have to look at data. It's very important, right? Like we have to look at quantitative and qualitative data and work with community at the beginning, because it's really important to do so. Because oftentimes we do things for community without involving the people who are being impacted. And that is another way of ignoring community and people who are being impacted. And we don't want to do that. So we want to have all voices at the table, all brains at the table, looking at the data and using that information to design tailored interventions that are hyper-local to the specific needs of community, and to measure to see if it's working. And if it's working, build to scale.
So following the numbers and the trends.
Following numbers and the trends. Yeah, very simplistic, and that is really how I did it.
What are some of the key risk factors for violence in our community? And what are some of the things that your team's doing to address them?
Now, some of the key risk factors are, in terms of community violence, are communities that have a lot of poverty, communities that have the school system is not as robust as it could be, a lot of families that don't have the support that they need, and essentially communities that don't have the material conditions necessary to ensure that people can live their best life, right? So, and like I said, so from my team's perspective, we look at asset mapping, and we look at the different factors in communities that's impacting that. And so we use that information to design interventions or to bring interventions, like the Harvest Trauma Recovery Center, like ATX Peace, our community violence intervention program that works in prime hotspot locations to provide services, case management, wraparound services, conflict mediation to individuals who are at the highest risk of being the victim or perpetrator of gun violence and community violence. I mean, those are some of the things that we do. We do a lot of other things, but...
What are some of the early signs that one might see displayed by an individual that shows that there may be some trending or propensity to commit an act of violence?
Well, I would say that, some of those things can be hidden within the individual. They may not display it or show it. But I think some issues around impulse control. And then I would also say just not having a lot of necessary resources. And there's people who have been involved in the justice system, and also people who don't have a job. In terms of when you talk about older folks, with little kids, it'll look different, but both will have like impulse control issues, or just some frustrations from the behavioral standpoint. But I think you have the behavioral things that's telling you that there's a problem, but those are also rooted from more structural things that are happening. The behaviors is kind of just a manifestation of something that's happening more structurally, if that makes sense.
Right. So, and when we're talking about violence in that context, we're not talking about going and doing something necessarily that is against the law, but something that may harm themselves. Or say something to somebody that would harm them, but not necessarily break the law. Correct. So how does the prevalence of firearms in our society play a role in public safety overall?
It plays a very big role. There's been a lot of social science research on this, that when there's a gun present and there's a heated situation, the gun is seen as an equalizer or seen as a way to solve an escalated situation. So if there's a gun present, someone is more likely to reach for a weapon. In a domestic violence situation, fatality goes up by 1,000% when there's a gun present. So guns make very stressful situations very lethal. And so it is important to have good gun safety education because, in the United States, we're allowed to have weapons. We need education on the importance of safely securing firearms, and also education around the stress response, because that's also triggers some of that. Like if I'm stressed and I'm not thinking clearly and I have a gun, I'm gonna go for that gun oftentimes.
Just following on along those lines, because this next question is about successful strategies for violence prevention, but I'd really like you to speak a little bit more about gun safety.
Oh, gun safety. Well, at the Office of Violence Prevention, we work with Lock Arms for Life, and which has a program called Safe Gun Storage Saves Lives. And Lock Arms for Life does a lot of education on the importance of safely securing firearms to prevent stealing of those firearms for nefarious reasons, to prevent suicides. Because when you have a gun lock on your weapon and, it provides that interruption in behavior, that if I have to go through my gun lock to lock it, it allows you to think to stop the behavior that you may be possibly doing. And so through Lock Arms for Life and Safe Gun Storage Saves Lives, we have gotten the word out about educating folks about that importance of safely securing your firearms, and gotten, since about over the past 3 years, more than 5,000 gun locks out to the public. And also we are, through Lock Arms for Life, creating a graphic novel designed for children to talk to them about the importance of gun firearm safety and not touching firearms and things of that nature.
Good. So what role does education play in violence prevention? You've already started that answer for me.
Sure.
And how does your office engage with schools and youth programs?
Education is crucial. Education and campaigns are one of the foundational pieces of public health. It is the way we change behavior and educate the public. And I think oftentimes there's a knowledge gap. And so the education, the campaigns help to close the knowledge gap and really explain to the public and people in the community about the various things that we're trying to uplift, prevent, and gun violence is no different, right? And so through the communication, we're able to change behavior. And then in terms of working in schools, we work with several programs in schools to address violence among youth. We work with the Council on At-Risk Youth, and they work with the students who are highest at risk. And they do group work, individual therapy, CBT, and things of that nature to help the youth change their behaviors and help with educational attainment. We also have a contract through the YWCA that does similar work, but they work with youth who are a little bit lower at risk. And then we work with Mexico Cartoon Museum, and we have various art programs to include murals, different art clinics and things like that, to help the kids with social cohesion, doing shared projects with expression, and kind of bridging gaps between cultures. So those are some of the work that we do with youth. And then also our Community Violence Intervention Program, ATX Peace, which is a collaboration between Jail to Jobs and Life Anew. They work in the schools as well to work with kids who are at risk for committing gun violence and community violence, and provide wraparound services to the kids, to the families, and to the schools. So, we're doing a lot of work in those spaces.
That's excellent, and to be commended, because it takes approaching this
from several different angles. Yeah. How do the social determinants of health, you've already kind of touched on this, such as poverty, education, access to resources, and other resource challenges, impact violence in our community? Well, if you don't have the access to the social determinants of health, that's going to increase your stress. Mm-hmm. That's going to increase the allostatic load on your system. And also, when you live in a society that has a lot of haves, but then you're in a position where you don't, and you can see the injustice in that, that's also a stressful condition. So I think addressing the social determinants of health, which is part of taking that holistic view and providing communities, individuals, the resources that they need so they can achieve peace, prosperity, and thriving, right? Is what's crucial to addressing violence, right? And there's a lot of factors that are related. So I'm not going to go on and on about it, but I have this thing, if you live in certain communities, if I think about my community where I live, at one point I had a doctor that lived next door to me. I had, a nurse that lived over here, engineer over here. And if I had a problem, I can go to a doctor and say, hey, what do you think about this? If I wanted my child to talk to an engineer, they can go do that, right? So some communities have, just through the nature of the community, these resources. Mm-hmm. And so in addition to having wealth, in addition to having a lot more privilege, but you have other communities that, because of systemic racism, divestment, all of these other things, and also disconnection, the sense of community and the resources within the community is not either there or not being realized. So the work really has to lean into those social determinants of health so that we all have a level playing field, and people who have what they need when they need it, if that makes sense, so that we can all thrive. Can you discuss any specific programs or initiatives that your office has implemented to address domestic violence? At the Office of Violence Prevention, we are working to bring standardized firearm surrender protocols to domestic violence cases. We received a grant through a competitive process through the Office on Violence Against Women. And so we have been working, and it's like a 3 to 5 year project. And I know before OVP was created, the community, Austin and Travis County, was working to bring a firearm surrender protocol. And with this grant, it allowed us to receive technical assistance and support and have this collective push to carry it over the finish line. And like I said before, the earlier stat that when a firearm is present, it increases lethality in domestic violence cases by 1,000. And then it's like a domestic violence call is one of the most dangerous calls for law enforcement. And so we want to develop a standardized surrender protocol that cuts across jurisdictions, that is done with community voices, advocates, that is done with the criminal legal system. Mm-hmm. And we meet bi-weekly to develop it. And we've been doing it for about a year so far. And it's been a beautiful collaboration. And not only are we going to develop this protocol, we will have to implement it and then measure it and make sure that it's successful. It's been a monumental task for the community, and I am so proud of the work has happened thus far, and that's going to continue to happen. And this working group is kind of interesting because people are so committed. We have magistrates there, we have judges, we have folks from the DA's office, county attorney's office, adult probation, APD, Travis County, the Law Library, SAFE, like APSA, like all of these groups, all of these organizations working together to do something that is so important to keep survivors safe, families safe, to provide safety for the entire community, because at the end of the day, we want to provide what people need to maintain their safety across the board.
It's so important that we make mention of that, because the thing that sets us apart as Austinites is that we do work together across the community. And everybody that you mentioned in there is not only representing their organization, but themselves are committed to the work. Yeah. Austin Public Health is very, very fortunate to have you as the director for the Office of Violence Prevention. And I just want to say that publicly.
Thank you.
We know as a community that we've weathered the storms and COVID pandemic and all of the things that happen day in and day out. And I'm sure there are people out there who want to join the ranks of the committed to help fight violence and work for violence prevention initiatives. So how can people get involved?
Well, they can reach out to, we have our website, austintexas.gov/OVP. We also have austintexas.gov/stress. In terms of maintaining safety and working in violence prevention, one way that we're trying to reach the public is through our Address Your Stress campaign, but also our Safe Gun Storage Saves Lives. I mean, that's one way that the public can get involved. Is we have free gun locks, as well as lock arms for life. If you have gun locks, so if you have a weapon and you need a gun lock, or if you know someone, we have that. So just reach out to us for that, or go to safegunstorage.saveslives.org. We are looking to have some collaborative meetings. So when we do that, we'll put it on our website. So check our website to work collectively to address violence in certain communities, as well as with the firearm surrender work. We have a survey out. I don't have the information on the survey, but we have a survey out wanting to learn from and talk to survivors of domestic violence about their experience navigating the criminal legal system, as well as the advocacy system, and how were those systems able to help them meet their needs. So I could provide more information regarding that survey later. I think it's really important to understand from the community standpoint what their experiences are, so that we can incorporate those those understandings into making a difference. And I'll also say this, that when we're looking at data, it's not just to collect the data, it's to understand what's happening and use that understanding to drive the work that we're doing. And then also we really want people that, like I said, when we build our groups out, to participate, because we want people with lived experience, people from the community, advocates, all stakeholders to be part of this process of creating, beloved community, creating safety for all, creating a peaceful Austin. So we'll be looking out for that on our websites.
That's all the time we have for today's episode of Health Talk. Thank you to KAZI 88.7 and to St. David's Foundation for their support of this program. Until next time, take care of yourselves and each other. This is Dr. Desmore Walks signing off. Be well.